In this video, uh, I'm going to explain drugs acting on nervous system part 2. In previous, I have discussed about the classification of cholinergic drugs. So the different classes of cholinergic drugs, and that classification it was chemical and pharmacological classification both. So in this, that's today anticholinergic drugs. Anticholinergic drugs. So we will look the classification. First, we will look the chemical classification. Okay. Then second, we will look the pharmacological classification depending upon the type of action the drugs show. For example, some of the drugs which shows mydriatic activity, some of drugs which shows antispasmodic activity. So depending upon the activity, we will classify, and then we will see the receptor selectivity based on the selectivity of the receptor. For example, we have the cholinergic receptors, we have M1 to M5. So depending upon the selectivity, some of the drugs which are non-selective, for example atropine, some of them are selective, M1 selective, M2 selective, M3 selective. So depending upon that, we will classify the drugs. First, we will look the classification based on the chemical nature. What is the chemical nature of anticholinergic drugs? And you know, anticholinergic drugs, they are used whenever there is cholinergic excess. For example, there are some several disorders like myasthenia gravis, in which there is a cholinergic excess. So we need to give anticholinergic drugs for management. For example, in case of myasthenia gravis, neostigmine is the drug of choice. And also organophosphate poisoning, which is one of the important poisoning. So that time we will give the anticholinergic drugs. Okay. Yes. So first we will look the chemical classification. As I told you in previous video, that chemical classification gives the idea about the chemistry of the drug. And when we know the chemistry of a drug, we can predict whether it is lipid soluble or water soluble. Okay. Or we can say it is polar or non-polar. Okay. And you know that the non-polar drugs, lipid soluble drugs, they can only cross the BBB, blood-brain barrier. So they can cross the blood-brain barrier, and they will be used in case of when the action is needed inside the brain. Okay. When the action is needed on the central nervous system. For example, I will give one of the example like physostigmine. Physostigmine, it is a tertiary ammonium compound. Okay, that I will explain you. So it can cross blood-brain barrier, but neostigmine, it doesn't cross BBB. So neostigmine is not used in case of when there is when the action is needed inside the brain. When the when the target, we have the target, when we target the part inside the brain. Okay, but neostigmine, but physostigmine, it crosses BBB because it's a tertiary ammonium compound, and this neostigmine, it is quaternary ammonium compound. So it is water soluble, or we can say it is ionic in nature. Okay. And yes, ionic or water soluble, you can tell. So it doesn't cross BBB, but the physostigmine, it does cross. So why I am explaining this, because I wanna highlight this, the importance of chemical classification, because some of usually physicians, they don't need this classification, but for a former doctor, and for a clinical pharmacologist it is important. That's why we will look the classification. First we will look the classification based on the chemical nature, chemical characteristics of a drug. Then we will look the pharmacological classification, and pharmacological classification we will look differently based on the action and based on the receptor target, and based on the duration of action also. We have the different criteria to classify the drugs pharmacologically. Okay, that we will look. So anticholinergic drugs, if we see the chemical classification here, chemical classification. Okay. See, reference for this is, I will show you the book. The reference for this is KD Tripathi. Okay, this is the 6th edition, pharmacological classification of drugs with dose and preparation. This one, and for chemical classification, I have this book is the reference for the chemical classification. Okay, medicinal chemistry with Ashok. Okay, so you can refer this book also. Actually, I have studied multiple books, and by studying the multiple books, I have made classification somewhat easier, because you cannot get all the classifications in a single book. So another book I have referred this textbook of medicinal chemistry with Professor Surendra Nath. Okay, so, and another book for pharmacology is pharmacological classification. This is the pharmacology revised and enlarged edition by K. Ravi Shankar. So and also some other books I have referred and made this classification very easy. Okay, so in order you wanna see the textbook, okay, then you can go for KD Tripathi classification and medicinal chemistry. For chemical classification, you can look these books. That's this medicinal chemistry book by Professor Surendra, and another book that is this. Okay, so you can read these books, okay, for chemical classification. So so the chemical classification of anticholinergic drugs. See, anticholinergic drugs, they are classified into, one is natural alkaloids. Natural alkaloids. Okay, or you can see the alkali nature, the chemical moiety in this alkaloid is propane. So you can say propane alkaloids. Okay, so in this we have examples. That is atropine. Okay, atropine is also referred as L-hyoscyamin. L-hyoscyamin. Okay. Another example we have, that is scopolamine. This is L-hyoscine. L-hyoscine. Okay. This DL and L depends upon the optical isomerism. Okay, optical isomerism you have heard in chemistry. So this atropine, it's also called D-L-hyoscyamine. Second example we have scopolamine, and it is L-hyoscyamine. Okay. Yes. And second, this is the natural alkaloids. In second class we have synthetic. Here I will write synthetic drugs. Synthetic drugs. This is natural and this is synthetic. Okay. Yes. Synthetic, it is subdivided into yes, it is subdivided into three classes. First one is, that is, they are the structural analogues of atropine. Means their chemical structure is related to atropine. Means they are also tropine. The chemical moiety in these classes of drugs are tropine. Okay. So we have, that is one structurally structural analog. Analogues of atropine. This is the first class. Okay. And second class we have, that's called that is structurally not related to atropine. Structurally not related to atropine. Okay. So just a brief recap. Anticholinergic drugs, they are classified into two types. First one we have natural alkaloids, that's the tropine alkaloid. In the example we have atropine and scopolamine. Second we have synthetic drugs. In synthetic drugs it is further subdivided into two classes. One is structural analogues of atropine, and another one is non-structural, or you can say structurally not related to atropine. So you can take a screenshot of this, because after a while I am going to rub this. So this is the I need to write this out here. Okay. So you can take a screenshot. Okay. So synthetic drugs. In this first we have example, that is structural analogues of atropine. Structural analogues of atropine. It is further subdivided into two categories. First one we have, that is the tertiary ammonium compounds. Tertiary ammonium compounds, and the another class is quaternary ammonium compounds. See, this class of drug, that's quaternary ammonium compounds, these class of drugs, they will be hydrophilic in nature. Okay, so these drugs, they will not cross triple B, because for a drug to cross triple B, the criteria or the condition should be that the drug should be lipid soluble, non-ionic in nature. Okay, yeah, lipid soluble and non-ionic in nature. So these class of drugs, that's quaternary ammonium compounds, they will not cross triple B at all. Okay, so in this class tertiary ammonium compounds we have example, that is homatropine. Homatropine, okay, and here we have example here, atropine methyl nitrate. Atropine methyl nitrate. This is the first example, and second example we have in this class, that is homatropine methyl bromide. Homatropine methyl bromide. Methyl bromide. And another example we have ipratropium. And ipratropium, okay. So another class we have that this is a structural analog of atropine. Another class we have that is structurally not related to atropine. Structurally not related to atropine. This class is further subdivided into two categories. One is tertiary amine compounds, tertiary amine, or we can say tertiary amines. Tertiary amines, and this is quaternary amines. Quaternary amines, okay. In tertiary amines we have examples. You can remember the mnemonic like here, PDC, provisional degree certificate. Of OT. OT means operation technician, okay. Yeah, operation technician, you can remember. So PDC of OT, okay. Some have, some students who are doing OT course, so you can remember the mnemonic like PDC of OT, okay. So the in case of tertiary amines, okay. So P is pyranzapine. P is pyranzapine. P is pyranzapine. D is dicyclomine. Dicyclomine. C is cyclopentolate. Cyclopentolate. O is oxyphencyclamine. Oxyphencyclamine. And T is propicamide. Propicamide. So these are the examples under tertiary amines. Another class we have, that is quaternary ammonium compounds. In this we have example, you can remember the mnemonic like have this. You can remember as a mnemonic. Okay. So the examples we have here, that's P for propanthaline. Propanthaline. I is isopropamide. Isopropamide. And G is glycopyrrolate. So this is the chemical classification of anticholinergic drugs. So as a quick recap, I will tell that these anticholinergic drugs, they are used in the management of whenever there is a cholinergic access. And for example, we have the disorders like myasthenia gravis, organophosphate poisoning, and dementia, Lewy bodies. Okay, so in these disorders and also Parkinsonism, so in these disorders, in order to manage or treat these kind of disorders, we are using anticholinergic drugs. So in this video we look the classification, that's the chemical classification of anticholinergic drugs. So anticholinergic drugs, they are classified into two categories. First one is natural alkaloids, another one is synthetic drugs. Under natural alkaloids we have example atropine and scopolamine, and under synthetic compounds we have example that's structural analogs of atropine. This is the first class, and second class is structurally not related to atropine. Under this class, structural analogs of atropine is further subdivided into tertiary ammonium compounds. The example under this class is homatropine, and under quaternary ammonium compounds, the example is atropine methyl nitrate, homatropine methyl bromide, ipratropium, and thiotropium. And under this class, that is structurally not related to atropine, we have it's further subdivided into tertiary amines and quaternary amines. Under tertiary amines, we have example pyrazapine, dicyclomine, cyclopentolate, oxyphencyclamine, and propicamide. You can remember that these drugs by remembering this mnemonic, that is provisional degree certificate of OT course. Okay, P for pyrazapine, D for dicyclomine, C for cyclopentolate, O for oxyphencyclamine, P for propicamide. And another class we have this quaternary ammonium compounds. We have three drugs under this class. The examples are propanthaline, isopropamide, and glycopyrrolate. So this was all about the chemical classification of anticholinergic drugs. In next video, inshallah, we will look the pharmacological classification. Okay, we will classify the pharmacological classification based on the action, what kind of action these drugs give. Okay, and based on the selectivity of the receptor, that we will look in the coming video. So subscribe my YouTube channel, and God bless you. Thank you.